So as we talked about, the COVID-19 model challenge wanted to learn about how social scientists predict and also assess the predictions about the trajectory of COVID-19 mortality. And so as Miriam said, about a year ago from December 2020 to January 2021, we solicited models of future COVID-19 mortality rates from social scientists. So during this period about a year ago, we asked people to predict COVID-19 mortality in terms of cumulative COVID-19, logged cumulative COVID-19 mortality rates per million. And we asked them to predict as of August 31, 2021. So this would have been about 8 months into the future. And then we also went through the social science prediction platform to elicit expert forecasts over the predictive power of these models, also looking forward into the future, since these elicitations were done in May 2021. So as is pretty clear, we've already passed August 31st, 2021. And so today we want to do something a little bit different. What we want to do is we want to think about how social scientists or data scientists approach number one with the possible benefit of hindsight. So what we're going to ask you to do is we're going to ask you to do task number one, sort of seeing exactly the same information that was available to the social scientists that wrote models a year ago, but you are going to sort of predict COVID mortality rates in the past, right, as of August 31st of this year. In some sense, this is closer to the modal prediction-oriented social science research, right? So often we're not necessarily trying to predict something that's happening in the future. We have some outcome variable that we want to predict, and we try to find some covariates that happened before that, but we may not be particularly precise about the sort of when we observe those. So there's going to be, and so we're asking you sort of to do the task that most prediction-oriented social science does, right? Which is to think about when both the predictors and outcomes are in the past. Okay, so you can think about it in sort of the difference between what you're doing today and what the modelers did before in this way. So obviously we've been observing COVID-19 deaths for almost 2 years now. This is sort of constantly evolving and growing, sadly. When modelers last year made predictions, we provided them with covariates and outcome data through November 16th, 2020, right? So that they had some baseline data off which to sort of predict the future, and we had them predict forward to August 31st, 2021. Your task, in contrast, since we are now almost to the end of 2021, is that you are going to see the exact same data that they saw, where we haven't updated it, but you are going to be predicting back to August 31st, 2021, right? So you'll see older data and you'll be asked to predict forward, but you have the benefit of sort of having lived through this time and seeing sort of how things changed over the course of 2021. And we're interested to see if your models change at all from those generated by people who were sort of predicting into the future. Okay. And so like it might be useful to think about just what changed between January and August. So what changed between what the last year's modelers had access to and what you have access to. You know, and the answer is probably lots of things. I'm sure I'm missing many, many things. Some obvious ones are vaccines. So it was about a year ago that sort of the first vaccines were rolled out outside of the trials, right? We had lots of questions about sort of supply, distribution, and then increasingly about vaccine hesitancy and vaccine efficacy, right? Over this period, we had the emergence of new variants, particularly Delta during this time. We also had geographic shifts in COVID incidence between January and August 2021. For example, India comes to mind as a place that had very few deaths at the time that people were predicting last year, and many, many more now, right? And then we also have a lot of changes in policies, particularly efforts to reopen and different changes in sort of the public health measures employed by countries. Right. And so you've observed at least some portion of this, and you may not have a great idea about how they map onto deaths, but you've seen these things that the people who were doing this last year had not yet seen. Right. So just so we can think about what you're going to be trying to predict and sort of these changes. So what we have here is this is for the cross-national challenge. So each of these lines is a country, and we plot the sort of trajectory of these logged cumulative COVID-19 deaths per million since the beginning of 2020. Sorry. And sort of what you will have access to is you'll have access to data as of 11/16/2020, right? Outcome data. And we will show you how you can sort of look at this data either on the site, or you can download all of this outcome data and the covariates and do this on your own. And basically, we're trying to predict outcomes at this point. So our main measure is basically the difference between outcomes on 8/31/2021 in the beginning of the pandemic. We also look at this level of changes since the data that was in front of you. So these are the three countries at like the 10th, 50th, and 90th percentiles in terms of the change between these dates. Okay. And so your task, as I've mentioned, is that given data as of November 16th, 2020, and your observations of the evolution of COVID, it should say 19, not 10, obviously. We want to ask you to consider predicting the cumulative COVID-19 deaths per million up to August 31st, 2021. For any of the four challenges. So this would be prediction of cross-national mortality rates or subnational mortality rates. This should say India, Mexico, or the US. I apologize for that, but thank you so much. And I'm happy to take any questions, so how you will explain more to you as we go.